Hello, I'm Dr Marcus Hughes. I'm a consultant in Liaison Psychiatry at St George's Hospital, and this is the lecture on Liaison Psychiatry. These are the learning objectives from the curriculum that I'm planning to cover in this lecture. As you can see, I'm covering some of the learning objectives from the Liaison Psychiatry part of the curriculum and some of the learning objectives from the organic psychiatry part of the curriculum. There are some learning objectives that I'm not planning to cover in this lecture. These are primarily learning objectives relating to medically unexplained symptoms, because those are being covered in another lecture by my colleague Jim Bolton. So let's move on to start talking about liaison psychiatry. Liaison psychiatry is psychiatry that's practiced in a non-psychiatric setting, so away from psychiatric hospitals and community mental health teams. Traditionally, liaison psychiatry has taken place and been practiced in large general hospitals, initially teaching hospitals, but it's now a much more widespread specialty. And we have liaison psychiatrists in the UK in some of the specialist hospitals as well. For example, the Brompton, which is a specialist chest hospital, or the Royal Marsden, which is a specialist cancer hospital. So as you can imagine, our caseload as psychiatrists working in those hospitals reflects the activity of the hospital where we're working. So the type of patients that we see will be quite different depending on the different hospitals where we're working. The specialty is also known as psychological medicine, and in the United States it's known as consultation liaison psychiatry, or CL psychiatry. These are the areas that I'm planning to cover in today's lecture. I'm going to talk about deliberate self-harm, not in any great detail because there's another lecture on deliberate self-harm, but it's a large part of our workload, perhaps 40 to 50% in a large hospital with a large accident and emergency department. So I'm going to make some reference to deliberate self-harm. I'm also going to talk about cognitive impairment in inpatients. As you can see, the list of areas that I'm going to cover in this lecture relate to distinct areas of the hospital. Deliberate self-harm patients we're often seeing in the accident and emergency department or in the acute medical unit soon after they've been admitted to hospital. Whereas I'm also going to talk about a group of patients with cognitive impairment, which is more likely to be seen in patients who have been admitted to medical wards for further treatment. I'm also going to talk a little bit about psychiatric emergencies, again presenting primarily in the accident and emergency department, but which can present in any of the wards and departments of the hospital. And then the third area that I'm going to talk about in a bit of detail is chronic pain. And chronic pain is an example of the type of problem that we might see as liaison psychiatrists in our outpatient clinics, so again another area of our work. There are various other aspects of work of the liaison psychiatrist that I'm not going to cover in detail in this lecture, and those are the ones that are highlighted because they're being covered in other areas of your curriculum, or because they're specialist areas that you're not expected to know about in detail as undergraduates. And finally, we're going to talk about mental capacity. So let's start with the case of a patient who has presented with deliberate self-harm to orientate you to the type of work that we do with patients with self-harm. And as I say, this is a large part of our caseload, 40 or 50% of our caseload for our team at St George's.